There is a number that exists right now, either in your medical records or quietly building inside your bloodstream, that is one of the most powerful predictors of your future health we have in medicine. And most people have either never heard of it, or if they have, they do not truly understand what it is telling them. That number is your HbA1c. And here's what makes it genuinely alarming from a clinical perspective. You can feel completely fine right now. No symptoms, no warning signs, nothing that seems wrong while that number is quietly climbing in the background, moving you month by month closer to heart disease, kidney damage, nerve damage, stroke, and type 2 diabetes, silently, without a single signal. In 13 years of emergency medicine, I have seen this pattern more times than I can count. Someone arrives in the emergency department at 54 years old with kidney failure, or a heart attack, or an infection in their foot that will not heal. And when you look at their history, at their blood results going back years, the HbA1c was telling the story the entire time, rising slowly, warning clearly. Nobody was listening. This video is about making sure that does not happen to you. Hello, my name is Dr. Miles. For the past 13 years, I've worked as an emergency medicine physician, seeing firsthand what truly impacts long-term health and what does not. That is exactly why this channel exists. My goal is simple: to give you clear, evidence-based medical information that can genuinely improve the quality and length of your life. No gimmicks, no miracle cures, and absolutely nothing being sold to you. If you are not subscribed yet, please do that right now before we go any further. Hit the subscribe button and turn on the notification bell. I release a new evidence-based video every single week, and I genuinely do not want you to miss what is coming now. And trust me, you are going to want to see what is coming next. Now, let's get into this properly. Before I give you the science-backed steps, I want to make sure you actually understand what this number means, because once you do, everything else in this video will make complete sense. HbA1c stands for glycated hemoglobin. Hemoglobin is the protein inside your red blood cells that carries oxygen around your body. When glucose blood sugar is circulating in your bloodstream, it sticks to that hemoglobin permanently. The more glucose in your blood over time, the more hemoglobin gets coated in it. Your HbA1c measures what percentage has been glycated. Think of it like this. Imagine leaving a spoon in a jar of honey for 3 months. The longer it sits, the more honey coats the spoon. Your HbA1c is essentially measuring how sticky your bloodstream has been over the past 3 months. Because 3 months is the lifespan of a red blood cell, old cells die, new ones form, giving us a rolling average that is remarkably accurate and almost impossible to cheat. In the UK, below 42 is normal. Between 42 and 47 is pre-diabetes. Above 48 is diabetes. In the US, below 5.7% is normal. Between 5.7 and 6.4% is pre-diabetes. Above 6.5% is diabetes. And here's the critical point that most people miss entirely. Pre-diabetes is not a waiting room for diabetes. It is a window. A period where your biology is still responsive, still reversible, still very much within your control to change. But that window does not stay open indefinitely. Everything I am about to share works through two main mechanisms: improving insulin sensitivity and reducing chronic glucose exposure. Keep those two phrases in your mind. Every single step connects back to one or both of them. Here is the thing that makes elevated HbA1c so dangerous compared to almost any other risk factor in medicine. It produces no symptoms in the early stages. None. You do not feel it rising. You do not feel insulin resistance developing. You do not feel the slow inflammation building around your organs. You might feel tired more often than you used to, a little more foggy in the afternoons, a little more dependent on sugar to get through the day, cravings that feel impossible to resist, weight that will not shift no matter what you try. Most people chalk those things up to stress, or getting older, or just being busy. And meanwhile, the HbA1c keeps climbing. The frustrating reality is that by the time someone feels the consequences, the neuropathy, the kidney dysfunction, the cardiovascular event, the process has usually been running for a decade or more. The damage was accumulating silently, long before anyone thought to look. This is why I want you to know your number. And more importantly, I want you to know exactly how to move it in the right direction. These steps work as a system. They compound on each other. Implement them consistently and recheck your HbA1c in 3 months, which is exactly the clinical timeframe we use, because that is how long it takes for your red blood cell turnover to reflect your changes. I am confident your number will move. Number 1. Remove the fastest glucose sources first. The most immediate lever you have is eliminating the foods and drinks that cause the steepest, fastest rises in blood glucose. Refined carbohydrates, white bread, white rice, pastries, breakfast cereals, crackers, break down into glucose rapidly and spike your blood sugar hard. But the most dangerous of all is liquid sugar. Fruit juice, fizzy drinks, sweetened coffee, energy drinks, and many smoothies deliver glucose directly into your bloodstream with almost no digestive delay. Your blood sugar goes up faster and higher than it would from the equivalent food eaten solid. Removing liquid sugar alone moves the needle for most people within weeks. This is not about eliminating carbohydrates entirely. It is about removing the ones that spike you hardest and give you almost nothing nutritionally in return. Number 2, build every meal around a buffer. Fiber, protein, and fat slow the rate at which glucose enters your bloodstream. Fiber forms a physical gel in your gut that blunts glucose absorption. Protein slows stomach emptying and stimulates insulin in a far more controlled way. Fat slows gastric transit. When carbohydrates arrive into a digestive system that already contains these nutrients, the glucose release becomes steady rather than sudden. The HbA1c impact over weeks and months is significant. Target 30 to 40 grams of fiber daily. Most people are getting half that. Target 1.6 to 2 grams of protein per kilogram of body weight. The Predimed trial, involving nearly 7,500 people, showed that a Mediterranean dietary pattern, high in vegetables, olive oil, fish, legumes, and nuts significantly improved metabolic outcomes, even without aggressive calorie restriction. Food quality was doing the work, not calorie counting. Number 3, build muscle deliberately. This is the step that most people ignore, and it is one of the most powerful things you can do for your HbA1c. Skeletal muscle is the primary site of glucose disposal in the human body. When your muscles contract, they pull glucose directly out of your bloodstream, independently of insulin, through a separate pathway activated by muscle contraction alone. More muscle means your body can clear glucose more efficiently every single day, whether you are exercising or not. A meta-analysis examining over 30 resistance training trials found meaningful HbA1c reductions from resistance training alone, independent of any weight loss. 2 to 4 sessions per week, built around compound movements. You do not need to spend 6 days in a gym. You need to be consistently stronger than you were 6 months ago. Number 4, move after every meal. Your muscles are most receptive to glucose uptake in the period immediately after eating. A 10-minute walk after a meal reduces the post-meal glucose spike significantly. Research published in Sports Medicine found meaningful reductions compared to sitting. And this matters enormously for your HbA1c because it is the accumulated effect of hundreds of post-meal spikes across weeks and months that drives your 3-month average up. Beyond post-meal walks, the research on sedentary time is clear. Even people who exercise regularly but sit for the majority of the rest of the day have worse glucose control than people who simply move consistently throughout the day. Aim for 8,000 to 10,000 steps daily. Break up prolonged sitting wherever you can. This is not formal exercise. It is restoring the movement that modern life has systematically removed. Number 5, protect your sleep as a metabolic priority. This is the step that most people do not take seriously until they understand the mechanism. Sleep deprivation raises cortisol, drops insulin sensitivity, and elevates fasting glucose. A study from the University of Chicago restricted healthy young adults to 4 hours of sleep for 6 nights. Within that single week, they developed insulin resistance comparable to early type 2 diabetes. Think about that. 6 nights of poor sleep and your metabolic profile shifts dramatically. Chronic sleep restriction raises HbA1c even when diet is held constant. You can be eating well, exercising regularly, and poor sleep will undermine all of it. 7 to 8 hours is not optional if lowering your HbA1c is a genuine priority. A consistent sleep and wake time, a cool dark room, and a real boundary around screens in the final 90 minutes, these are not lifestyle suggestions. They are metabolic interventions. In 13 years of emergency medicine, I have rarely admitted someone to hospital with a normal HbA1c. I have admitted a great many people with a high one, with kidney failure, with neuropathy, with heart disease, with strokes, people in their 50s who had no idea this was coming, people who felt fine right up until they did not. And what stays with you, what I carry from every one of those cases, is that at the earliest stages, so much of this is reversible. Prediabetes can be reversed. Early type 2 diabetes can often be put into remission, but you have to act when the number is still 44 or 45, not when it is 75 and the complications have already taken hold. The 5 steps I have given you today are not extreme. They do not require perfection. They require consistency applied together, compounding over weeks and months, gradually shifting the metabolic environment that your HbA1c is reflecting. Remove the fastest glucose sources. Buffer every meal with fiber, protein, and fat. Build and protect your muscles. Move after eating. Guard your sleep. Do those 5 things consistently, and your HbA1c will respond. Your biology will respond, because that is what science actually tells us. I am Dr. Miles, and if this video gave you something valuable today, please hit the like button right now. It takes 1 second, and it helps this information reach the people who need it most. And if you are not yet subscribed to this channel, please subscribe right now. Every single week, I release evidence-based videos on exactly these topics, the information that genuinely moves the needle on how long and how well you live. No supplements, no shortcuts, just science. I do not want you to miss a single one. I will see you in the next one.